Today I have a 5-year-old well-appearing Caucasian male who presents for a well visit with Grandma, who is the primary caregiver and a reliable historian. Grandmother has questions today about the immunizations needed before the child starts kindergarten, and she is also concerned about a rash that is itching all over the patient's body and has been there for about a month, and she is concerned it's eczema. Grandmother describes the rash as red and itchy and is covering his arms, abdomen, behind the knees, elbows, and denies spreading to the neck or face. She claims it began about a month ago and has not gone away or improved. There are no aggravating factors observed, and the only relieving factor is minor relief of itching with the use of the calamine lotion. She denies any effect on function as the child is still very playful. He is eating, drinking, voiding, and sleeping well despite the itching. She denies fevers, sore throat, cough, diarrhea, and vomiting. She does appreciate a runny nose and sneezing, but he has not had changes in his breathing or distress. He has not had any recent illness and denies daycare use, but he does play with the neighborhood kids. He is not taking any prescription medications, herbs, supplements, or vitamins. He does occasionally receive Tylenol for fevers, and Grandma gives him a spoonful of that, and he has also been using the calamine lotion generously all over his rash. She did attempt to use Neosporin, but there was no relief, so she discontinued the use. Of note, Grandmother has primary custody of the child, and the mother is no longer involved. All family members do not have any pertinent medical history, but the father of the child is unknown, so we do not know his history. Patient does not have allergies besides seasonal allergies, and Grandmother denies food allergies. The child is currently unimmunized. They live in a farmhouse in the country. Grandmother denies mold, pests, dust, pets, and smoking in the home. She's unsure when the house was built, though. Pertinent information on his review of symptoms includes a rash to the trunk, arms, elbows, and behind the knees, and chronically dry skin. He has no vision issues or cataracts, but occasionally watery and itchy eyes. Grandma endorses a runny nose and occasionally some sneezing, but denies a cough. She also denies wheezing, frequent URIs, chest pain, sputum, and difficulty breathing. And again, he is unimmunized. Patient is developing appropriately at this time and is well appearing. He is afebrile with a temp of 36.7, his heart rate is 87, and his respiratory rate of 20. His blood pressure is 110/71, and he's in the 99% on room air. He has a pain score of 0 on the FACES scale. He's in the 50th percentile for height and weight, and he's weighing in today at 42 pounds. There is no recent weight loss or major weight gain reported. I do appreciate palmar hyperlinearity and periodic erythema, excoriation, and scaling to his trunk, his neck, bilateral arms, and legs. He also has thickened plaques to his elbows and lacinification to the bilateral and cubital fossa, popliteal fossa, wrists, and ankles. The largest area measures 5 by 3.5 centimeters. He has no ichthyosis, warts, or molluscum. Lymph nodes are of normal size, and he denies sinus tenderness. He has full range of motion of his neck, no discharge or conjunctiva of his eyes. Itching and tearing will sometimes occur after he plays outside. He has a patent nose with no abnormal features, but some drainage from his nose that is clear and thin in appearance, and some erythema and dryness around the nares. Respirations are normal in rate, rhythm, and effort. He does not have wheezing, crackles, or stridor. His abdomen is soft, flat, and non-tender, and he moves all extremities fully and has no joint swelling or pain. At this time, the differential includes eczema, as the skin assessment findings correlate with this diagnosis, and he is positive for allergies. He also has a long history of dry skin. However, his dad's family history is unknown, but otherwise no history of eczema in the family. The differential also includes allergic or contact dermatitis. However, there's been no relief and the rash is pretty well spread. Psoriasis is another option, but there's no rash noted in his groin area.